Hey Melody.
Good morning.
Good morning. How are you?
I'm good, thank you.
Do you have a minute to help me with one of my patients? I'm having a difficult time trying to identify the appropriate support surface for her.
Sure, that's what I'm here for.
Thank you. There are so many mattress options and it can be difficult to track down when to use each one.
Yes, there's actually a tool recently developed by the WOCN Society that we can use. It's an algorithm that will allow you to choose the right support surface for your patient for pressure injury prevention and treatment.
Now, shouldn't a wound ostomy continence nurse like yourself be making that call?
Yes, that's in our scope of practice, but we're not always around. This algorithm will allow you to choose the right support surface and not delay any care. Let's take out your phone and you can tell me more about your patient.
Okay then, Mrs. Chang is a 82-year-old female. She came here through the emergency department with a fractured left hip due to a fall in her home. As I understand it, she wasn't using her walker. Her daughter came over fairly soon after that, so she wasn't down long. Apparently, orthopedics is going to take her to the operating room sometime tomorrow. Her past medical history includes congestive heart failure, hypertension, and urinary incontinence. It says here she is 5 feet 2 inches tall and weighs 145 pounds. Let's see, the admission lab values say the WBCs are 14.4. Her hemoglobin is 11, hematocrit 23, and the electrolytes are all within normal limits. And yes, her albumin is 3. The nursing admission notes say that her skin is intact. According to the bedside nurse just now, her Braden score is 13 though, with her mobility subscale score being 2 and the moisture subscale score another 2.
Okay, that's all important information for us to consider as we use the tool. Let's open up the browser and go to algorithm.wocn.org. Click on Get Started and you can learn a bit more about the algorithm's development and read a peer review article published in the Journal of Wound, Ostomy, and Continence Nursing. Close the box to enter the next step in the algorithm, which is an initial skin assessment. We know that Mrs. Chang's skin is intact, so we'll choose that option. We will then complete a pressure injury risk assessment based on the patient's weight distribution, and specific comorbidities and major risk factors, including advanced age, fever, protein intake, and anemia. Next, we will use the Braden scale for predicting pressure sore risk. If you want to learn more about the Braden scale, simply follow the link on this page. According to our notes, Mrs. Chang has a Braden of 13, so she is definitely at risk for developing a pressure injury. Our next step is to determine the appropriate preventative support surface. So we will click on this blue circle to determine the best prevention surface for Mrs. Chang. We need to choose a support surface based on a few things here that are all evidence-based. To begin, the blue box on the left says that those are current patient characteristics and risk factors, which are listed immediately to the right as A through D. A quick run-through on these shows us that she is not really of bariatric proportion, so we don't need that. We do not wish for her or anyone to become entrapped or fall from an elevation, and we do not carry mattress overlays for that reason. Your patient has no history of a previous pressure injury. She is definitely at risk with a Braden score of 13, and she did fall after all. For us, E, all of our rental support surfaces are inspected by both a manufacturer's representative and our facilities management team to ensure they are functioning properly. Our staff routinely minimize the number and the type of linen layers between the patient and the support surface, so we don't really have to worry about that. It's a great reminder for those who don't though. Let's look at Table A, those Braden subscale scores the bedside nurse was telling you about. The evidence tells us that moisture and mobility are the two most important measures to control and prevent pressure injuries. Moisture goes down the left-hand side. We can recall that the nurse said our patient was a 2, and that means very moist. As for mobility, the nurse said that our patient was a 2 here as well, meaning that she is very limited in her mobility. If we see where those two axes meet, it tells us that Mrs. Chang needs a constant low pressure surface with low air loss feature. Before we look to see how to get to this, let's first check to see if there are any precautions or contraindications for using that product with Mrs. Chang. We can close out that chart by clicking on the X at the top. We can click on Table B to find out. Let's look down the left-hand column to find the constant low pressure with low air loss feature and check out the precautions. Mrs. Chang is not combative, restless, or in an agitated state. Now let's look at contraindications. Mrs. Chang does not have anything on this list that would prevent us from using the support surface we have identified as best for her. For the most part, Dr. Hongali, this is all you have to do. Once you order what you want, our portable equipment team will get you the brand of therapy that we have on our contract. But if you are wondering, what kinds of products do we have here at Cone Health? What if a patient tells you they sleep on one kind of mattress at home and you are wondering if it is the same as the one we have here? Then this last table is for you. Let's first close this box. The last table is a product formulary for support surfaces. It's not all-inclusive, but it has a nice sampling of the products available, so this tool can be used by hospital staff or by those who work in LTACs, skilled nursing facilities, and home health agencies. If we click on this table, we can skip over the overlays portion, since I mentioned we do not carry those here at Cone Health. Scrolling down to mattresses, we come to the constant low pressure with low air loss. In the column that is the farthest to the right, we see a representative list of those manufacturers and products that deliver that therapy. The products we use here at Cone Health are on that list.
It's really easy to use. It helped narrow down the support surface options that we have available.
See, now you don't even need us.
Well, we know that's not true, but it is a really helpful tool when you're not around.
I like the support surface algorithm because it's a convenient website. We can access it any time, day or night, of any shift. Even when the wound ostomy nurses are not available for us, we can do that ourselves, and it's self-guided, and we can get the patient on the correct surface at the correct time. The algorithm also helps us to avoid delays in care, to promptly treat the patients as needed.
It's extremely critical that all staff understand support surface options that our patients may have, because we're not here 24 hours a day. There may not be an expert on hand all the time to tell the clinicians what would be the best support surface option for our patients. So to empower them with a tool like this support surface algorithm is critical for the patients getting a timely support surface that's appropriate for their needs. Reduction in pressure injury prevalence is something that's obviously very important to the WOC nurse team. We all need to continue to educate the other clinicians, both at the bedside and fellow WOC nurses, and make sure that we are aware of all of the support surface options. I would envision a physical therapist being able to remotely pull up this algorithm on their phone, and just with a few simple clicks and swipes, they are able to see exactly what support surface they may need for their patient. It's very simplistic, it's very user-friendly. Luckily, we're in a day and time where everyone has a phone and is able to have access to this algorithm.
I think it's a great tool to empower not only me, but some of the nurses to kind of advocate for their patients and provide the care that they truly need.
A lot of times they may use us as a support on what we feel like they might need and what we've seen so far as mobility or skin integrity. So we collaborate together with nursing to kind of get that need met.
At Cone Health, we seek to provide evidence-based tools to develop them and implement them to help our expert clinicians at the bedside provide quality care and prevent delays in treatment of care. Now, we know these expert evidence-based tools don't replace our clinical staff. However, they do help support their decisions to provide that quality care, and many times additional consults are needed for that expert care. So these evidence-based tools help us with that decision making.